From working in the NHS, I was aware that things were not as they should be, and that our NHS here in Scotland was delivering poorly for patients and their families, and was not recovering as quickly from the COVID pandemic as other parts of the UK health service were. But my experience of writing this report and looking at the data and finding out exactly what was going on and using publicly available data shocked even me after a 40-year career. Scotland's NHS is spending more money, has more staff, has more recommendations and reports than ever before, and yet we're not delivering for the people of Scotland. This SNP government, over 19 years in power, has failed to deliver good patient experience and good patient outcomes. And you've heard that from Francesca on mental health, in Jordan and his personal experience of cancer care, and from Jackie. And this report is filled with statistics. Amongst the most shocking is that it was 10 years ago possible to phone NHS 24 and your call be picked up in 9 seconds. That now takes 22 minutes. There are more than 10,000 people in Scotland waiting more than 2 years for an appointment or a procedure. The equivalent figure in England, a country more than 10 times the size of Scotland, is less than 200 people. And perhaps most shockingly of all, we in the country of Scotland have the lowest life expectancy of any part of the UK. There is no greater measure of the effectiveness of healthcare and the custodianship of our country than our life expectancy. We live shorter lives than our fellow UK citizens. So how did it come to be like this? We have a dedicated staff. As Josh has outlined, we have tremendous research into life sciences in our universities and colleges, and we have a public who really want the NHS to work. So why has the SNP been incapable of delivering good and safe healthcare? Well, I believe because they are not interested in doing so. They have had enough time. It's now time for a change. Only one party in this Holyrood election is being led by someone who has actually worked delivering NHS healthcare. Anas Sarwar worked as an NHS dentist in Paisley for 5 years. He has personal experience of delivering healthcare. But I believe this is more than about his experience. It's about his values. Over the last couple of weeks, I think all of us who follow the news closely have witnessed his compassion for the victims of the Queen Elizabeth University Hospital scandal. We have also noted his consistent calling out and criticism of the NHS government's denial and delay in admitting that there was any problem at that hospital. So this is not just a man with experience of delivering healthcare, this is a man with the correct values to lead our country. And so I hope, and I believe we should all hope, that Anas Sarwar is going to be our next First Minister of Scotland. It is my privilege and honour to introduce Anas Sarwar.
Friends, in 100 days' time, Scotland faces a choice. The most significant choice it's had to make in 20 years. And in 100 days' time, we can save our most precious and treasured National Health Service. 100 days to take our country in a different direction, and 100 days to give hope back to the people of this great country. We have a plan to fix our NHS and make it fit for the future. But above all else, we want to take our NHS out of the hands of incompetent ministers and bureaucrats and managers and put it back in the hands of the people it truly belongs to, the patients, the doctors and the nurses. And that's the promise and commitment I make to you today. But I also want to talk about the risk if we don't change course. The risk if we just view this election as being one of non-consequence, one of protest, not one ultimately of choice. This election won't decide what happens somewhere else. It will decide what happens here in Scotland. It will decide what happens to our schools, our hospitals, our GP services, our social care system, our families, our communities, our towns, our cities, our villages and our islands. This election is about our NHS. And for any other political party or any other political leader, including the sitting First Minister John Swinney and the SNP, they want to make this election about everything but Scotland, but I am determined to make it about Scotland. And who can blame them for wanting to talk about anything else apart from their record? On their watch, more than 830,000 Scots waiting either for treatment or for diagnosis, including almost 10,000 waiting over 2 years. Over 2 years on an NHS waiting list. That's 53 times higher than the number in England, despite them having 10 times the size of population we do. It means for all those thousands of people who wait far too long at A&E, and when the Royal College of Emergency Medicine tell us that that leads to unnecessary deaths in the future. To all those people that are stuck in hospital, desperate to get out, cleared to leave, but can't, because they can't access that care package either at home or indeed in a care home. For all those who've had to remortgage their homes, borrow from friends and family, or have had to travel elsewhere to get the private diagnosis or the private treatment when they should be getting that here at home. Those waiting in pain, in anxiety, and putting their lives on hold, and all the personal consequence that has on their health, but also on their economic opportunity, and indeed on their friends and family. That's the record of shame for the SNP, that's the record of failure, and that's one that we want to stop and take our NHS into the future. Now, people often say that all hope has gone. The NHS can never be fixed. It's always going to be broken. It can't go back to those founding principles. I reject that out of hand. Our NHS can work. Our NHS can be fit for the future. Our NHS can deliver for everyone the way it should. But what we need is a government that meets the ambition of the people and works as hard as our NHS staff do if we are to make it a reality. So what will Scottish Labour do to fix it? First, we will declare that national waiting times emergency to make sure patients can receive the care they need regardless of where it is available across the country. We will also make sure we take capacity wherever it exists so we can clear those backlogs and so people don't have to use their own money to get the treatment they need. We will reform primary care to end the ATM rush for a GP appointment, and we will bring back the family doctor. We will end corridor care and stop all the bed blocking by making sure we invest in social care and the pathways that people need to get those care packages at home or indeed to have that place in a care home. We will also bring parity in terms of mental health and physical health by launching the Mental Health Emergency Response Service, making sure there are trained paramedics, nurses and mental health support responding directly to 999 calls, not untrained police officers. Now that does two things. One, of course, it gives better dignity and care to the patient, but it also releases those police officers so they're not stuck in AD departments, they're not stuck in courtrooms, they're not stuck responding to 999 calls. Instead, they're on the front line supporting their communities and fighting crime. And ultimately, we will cut the bureaucracy so we've got fewer chief executives, fewer finance directors, fewer managers and more nurses and more doctors on the front line. Fewer bureaucrats who think their job is to stand up and defend the government and conspire against the patient, and more money to the doctors and the nurses that treat the patients and better outcomes for people across the country. I believe what has happened at the Queen Elizabeth University Hospital is criminal incompetence. It's negligence, it's criminal incompetence, and those responsible must be held to account. And what the public inquiry has done is looked in detail at the decision-making and the decision-making gaps in the managers and the staff on the site. What it hasn't done is investigated and questioned those responsible for the political decision-making. So I believe that Lord Brodie should reopen the inquiry, that he should hear directly from the First Minister at the time, Nicola Sturgeon, from the Deputy First Minister and Finance Secretary at the time, John Swinney, and from the Health Secretary at the time, Shona Robeson, so we can have full transparency about who knew what and when, and why that hospital was allowed to open too early, and the negative consequences, devastating consequences that followed, with patients getting infections they shouldn't have and lives being lost when they shouldn't have too. So I want all that to come and see the light of day. And let me also make this commitment. For 7 years now, we've been told repeatedly by SNP ministers and officials that there's nothing to see here. And they've always presumed that somehow we'll just go away, or the patients will go away, or the families will go away, or somehow I will go away. Let me make this abundantly clear to every single minister in government, every single official. We are not going away. We will get the answers, we will get truth, and we will get justice. And you may try and evade that for the next 100 days. But in 100 days, we will elect a new government in this country. In 100 days, we will get our NHS back on track. In 100 days, we will save our NHS. But in 100 days, we will then also shine a light on the most ultimate cover-up in this country's political history, and you will be made to pay the price.